The Indiana University Health Methodist Hospital Transition Clinic was established to care for patients who are at high risk of readmission. Reducing 30-day readmission rates is our goal. Currently, our readmission rates for patients who are seen in the transition clinic are at 8.8%. That's compared to readmission rates for the hospitalist patients, who are the primary population of patients that we see. Their readmission rate is 17.3% currently. So as you can see, a dramatic reduction in readmission rates for patients who are cared for in the transition clinic.
As a hospitalist who's been here about 5 years at Methodist Hospital, we started the transition program about a year ago. What we've seen in our transition clinic is that the high-risk folks that we've identified that need additional care after the hospitalization, we've seen about a 50% reduction in their 30-day readmission rates, which is quite impressive, particularly with us identifying these patients as high risk. We offer this service to patients right now that we think are high risk and have them come to our clinic. And it's an aggressive enrollment with our nurse practitioners, with our pharmacists, with our social workers, and with our care managers. So we've seen a good amount of success in piloting this program, and we're looking for ways to improve and enhance the number of patients that we can serve. And I think we're only still hitting about 10% of our total discharged patient population right now, and we're hoping, since we've had such a significant improvement in there, that will mainly improve patient care, but do it to a wider patient base.
Hi, my name is Kathy, and I work in the adult ambulatory transition clinic. And my experience with the clinic is it gives the opportunity for those people that have little or no insurance, and gives them a place to go and then follow their care from the point of discharge from the hospital onto a primary care physician. I think it's a great opportunity for those patients, and I think that our clinic is doing a great job on serving those that are getting out of the hospital.
Hi, I'm Michelle O'Connor. I'm the nurse practitioner here at the transition clinic. And I think some of the things that we've done to really help patients is that we've been able to look and see those who haven't been able to get their medications and help with that piece of it. We've even been able to work with patients who don't have a primary care doctor, and even if they had one, didn't ever follow up. And we've kind of been able to transition them on over to the idea that they need to have follow-up care, they need to be taken care of by a provider, even for regular visits, to help prevent things from happening also.
Some of the additional benefits to the IU Health Methodist Hospital Transition Clinic are quick access to quality post-discharge care. Our scope is to provide care for patients who need post-discharge care and do not have a primary care provider or cannot establish an appointment with a primary care provider in the necessary time frame recommended by the hospitalist providing care at patient's discharge. We share the EMR across a continuum of care so that the patient's medical record is seamless between his inpatient experience and the outpatient experience. We also can provide further discharge teaching and validation. We can help improve medication compliance through patient education, determinations of eligibility for other pharma-sponsored free drug programs, Medicare Part D, and etc. are in close proximity and are very connected to the Methodist Hospital. We are supported by a pharmacist in the clinic, and each patient has an opportunity to meet and discuss their medications with a pharmacist. We also help provide a transition to the PCP, to the patient's PCP, or on occasion we do transition care to a new PCP if the patient does not currently have a PCP.